Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing 10 medications used to treat anxiety. Before I talk about the medications themselves, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. This video is really just to give you an idea of what's out there in terms of medications used to treat anxiety, so we're only going to scratch the surface on each medication. But if you're looking for more information on any of these medications, I've covered them all in the past, so just simply type in the name of the drug in the YouTube search bar, followed by Drug Talk, and you should find my videos. Anyway, I've put together some slides to go over this information, so let's just jump right into it. So the first medication to cover here would be Lorazepam or Ativan, which is a benzodiazepine. Medication would not be used to prevent anxiety. Rather, when you have anxiety, you would take this medication to subside the symptoms. This medication binds highly to gamma-aminobutyric acid, or GABA, benzodiazepine receptor complex without displacing GABA. It binds to a specific attachment site to improve GABA's attraction to its own receptor site on the receptor complex. In terms of dosing, the initial dose would be 2 to 3 milligrams per day, orally divided in 2 or 3 daily doses. For a maintenance dose, we would usually see 2 to 6 milligrams per day, again orally divided in 2 or 3 daily doses. Doses may vary from 1 to 10 milligrams per day. Some side effects with this medication would be asthenia, or abnormal weakness, which may happen 4% of the time. Dizziness may happen 7% of the time, and 16% of patients may experience sedation. 3% of patients may experience unsteadiness, and some patients may experience depression. One serious side effect would be delirium. Next up, we have a similar medication, Clonazepam or Klonopin. For this medication, the mechanism of action is related to its capacity, again, to enhance GABA activity, which is the major inhibitory neurotransmitter in the central nervous system. For dosing with this medication, the initial dose would be 0.25 milligrams orally twice daily. After about 3 days, the patient may increase the dose in increments of 0.125 milligrams to 0.25 milligrams twice daily every 3 days to a target dose of 1 milligram per day. Some patients, however, may benefit from doses up to 4 milligrams per day. In terms of side effects with Clonazepam, we may see coordination problems 6% of the time. 8% of patients may experience dizziness, while 37 to 50%, high percentage here, may experience somnolence. Problematic behavior may occur 25% of the time, and 8% of the time we may see an upper respiratory infection. Fatigue comes in at 7%, ataxia up to 30%, and one serious side effect would be depression. Another benzodiazepine used to treat anxiety would be Alprazolam or Xanax. So this medication exerts its effects by binding to various stereospecific receptors in the central nervous system. It may also exhibit antidepressant properties, which differentiates it from other benzodiazepines. In terms of dosing with Alprazolam, for the immediate release formulation, 0.25 milligrams to 0.5 milligrams orally 3 times daily. Patients may increase every 3 to 4 days if necessary, and the maximum dose would be 4 milligrams per day, given in divided doses. In terms of side effects with Alprazolam, we may see a decreased appetite 7 to 28% of the time. We also may see an increased appetite 7 to 33% of the time. 3 to 27% of patients may experience an increase in their weight, and up to 26% may experience constipation. Reduced salivation may happen 33% of the time, which could cause xerostomia 10 to 15% of the time. Cognitive disorder may happen up to 29% of the time, and up to 10% of patients may experience confusion. Somnolence can occur up to 76% of the time with Alprazolam. Irritability comes in at 33%. Another benzodiazepine used to treat anxiety would be Diazepam or Valium. So the mechanism of action is thought to involve potentiation, again, of GABA neurotransmitter, resulting from the binding at the benzodiazepine site of the GABA-A receptor. For dosing with Diazepam, we may see 2 to 10 milligrams orally 2 to 4 times a day, depending on symptom severity. We could also see it given 2 to 10 milligrams intramuscularly or intravenously every 3 to 4 hours, again depending on symptom severity. Some side effects with Diazepam or Valium would be ataxia, dizziness, a headache, incoordination, somnolence, euphoria, and then serious side effects would be suicidal thoughts or central nervous system depression. The next medication here used to treat anxiety would be Buspirone or Buspar. So Buspirone exhibits high affinity for serotonin 5-HT1A receptors, moderate affinity for brain D2 dopamine receptors, and no significant affinity for benzodiazepine receptors. This medication is unlike the other ones where it's not a benzodiazepine. Dosing with Buspirone, we would start with an initial dose of 7.5 milligrams orally twice daily, with the option to increase the dose by 5 milligrams per day every 2 to 3 days as needed. And then the usual dose would level out between 20 and 30 milligrams per day, given in divided doses. The maximum dose would be 60 milligrams per day. In terms of side effects with Buspirone, 8% of patients may experience nausea, 12% may experience dizziness, and a headache may happen 6% of the time. 10% of patients may experience somnolence, and nervousness comes in at 5%. A serious side effect with this medication would be congestive heart failure. Next up, we have Escitalopram or Lexapro, also known as Cipralex. So this medication is a selective serotonin reuptake inhibitor. It is also the S enantiomer of racemic citalopram, another medication you may have heard of. Escitalopram enhances serotonergic activity in the central nervous system as a result of its inhibition of 5-HT or serotonin reuptake in the central nervous system neurons. In terms of dosing, the initial dose would typically be 10 milligrams per day orally as a single dose given in the morning or in the evening. The patient may increase the dose to 20 milligrams per day after at least 1 week of therapy. In terms of side effects with escitalopram, abdominal pain may happen 2% of the time. 3 to 6% of patients may experience constipation. Diarrhea can happen 6 to 14% of the time, and up to 18% of patients may experience nausea. Xerostomia can happen between 4 and 9% of the time, and then we have dizziness between 4 and 7% of the time. Up to 24% may experience a headache, and up to 14% of patients may experience insomnia. There's a possibility of sexual dysfunction with this medication, as well as fatigue, which comes in at 5 to 8% of the time. One serious side effect with escitalopram or Lexapro would be serotonin syndrome. The next medication here used to treat anxiety would be Clorazepate or Gen-Xene. So Clorazepate is a benzodiazepine anxiolytic, or medication used to treat anxiety, with the depressant effects on the central nervous system. In terms of dosing, if you're using the immediate release formulation, we may see 15 to 60 milligrams per day orally given in divided doses. The usual dose would be 30 milligrams per day, again in divided doses. However, some patients may start with 15 milligrams given at bedtime. One side effect with this medication, a common side effect, would be somnolence. Next medication we have to discuss here would be Doxepin or Silenor. So Doxepin possesses pharmacologic properties similar to other tricyclic antidepressants. The exact mechanism of action on anxiety is not completely understood. In terms of dosing, using the capsules, the initial dose would be 75 milligrams per day orally for mild to moderate severity illness. If anxiety is very mild, the patient may be controlled with 25 to 50 milligrams per day orally. They may gradually increase the dose to 300 milligrams per day in more severe cases, and the usual dosing range would be 75 to 150 milligrams orally daily in a single dose or in divided doses. For side effects with Doxepin, constipation may happen 4% of the time, nausea may happen 2% of the time, xerostomia or dry mouth may happen 15% of the time, up to 10% of patients may experience dizziness, and up to 9% may experience somnolence. Urinary retention may occur, as well as an upper respiratory infection, which may happen 2 to 4% of the time. One serious side effect with Doxepin would be hypotension or low blood pressure. Next up, we have Duloxetine or Cymbalta. So Duloxetine is a selective serotonin and norepinephrine reuptake inhibitor. In terms of dosing, the initial dose would typically be 60 milligrams orally daily, but some patients may start with 30 milligrams orally once daily for 1 week and then increase to 60 milligrams orally once daily. The maximum dose would be 120 milligrams orally once daily. For side effects, 1% of patients may experience weight loss, 9.5% may experience constipation, and a decrease in appetite may happen 6 to 8% of the time. Diarrhea comes in between 6 and 9%, and nausea may happen up to 25% of the time. Xerostomia or dry mouth may happen up to 14% of the time. Fatigue may occur, and one serious side effect with duloxetine would be a hypertensive crisis. And the last medication we have to discuss here is trifluoperazine or Stelazine. So trifluoperazine is a phenothiazine that has effective activity against anxiety and schizophrenia. It also exhibits anticholinergic activity. In terms of dosing with trifluoperazine, we may see 1 to 2 milligrams orally twice daily. And it should be noted here that doses should not be administered at doses of over 6 milligrams per day or longer than 12 weeks. In terms of side effects, we may see hypotension or low blood pressure, diminished sweating, photosensitivity, constipation, xerostomia or dry mouth, dizziness, dystonia, Parkinsonism, somnolence or tardive dyskinesia, blurred vision, urinary retention, and then a serious side effect would be prolonged QT interval. All right, everybody, that's all we're going to talk about today with 10 different medications used to treat anxiety. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.